Well, good afternoon everyone, and I'll begin by handing over to the Health and Social Care Minister, David Ashford, who will provide you with the latest figures.
Thank you, Chief Minister. The total number of tests undertaken now stands at 8,181. The total number of tests concluded is 8,174, so we are awaiting the results of 7 tests. We have no new identified cases, so our total case count remains at 336. Thank you, Chief Minister.
Okay, thank you very much, David. And yesterday we reached the milestone of 70 days without any new cases of COVID-19 here on the Isle of Man. Now, as the days with no new cases turns into weeks, hope and confidence grew that we had turned the tide on the virus. Acting on the evidence, government responded accordingly, easing restrictions which enabled many aspects of island life to return to normal, albeit with heavy heart of those who we have lost to this horrible disease. The economic shock of COVID-19 continues to be felt both globally and closer to home. And I'm acutely aware that there has and continues to be hardship as a result of the pandemic. We know that unemployment has increased and that some sectors are struggling. The truth is, there remains challenges as we seek to restore the prosperity of our island for all. As a government, we are not complacent nor dismissive of those who continue to experience the economic impact of COVID-19, and we are working to focus and determination to minimise the effects of coronavirus on our economy wherever reasonably we can. And we are ready to adapt to the changing circumstances around us and seek out and seize new opportunities. As I mentioned at last week's briefing, following the budget update by the Treasury Minister, this work is being led by the newly established Economic Recovery Group, which reports directly to the Council of Ministers. The group will be working throughout the summer and beyond with the backing of a new £100 million Economic Recovery Fund. Despite the challenges that remain, we must not forget that our collective, gritted determination to battle the spread of COVID-19 on our island has put us in a strong and enviable position. As we slide back into our routines, it is perhaps easy to occasionally forget where we have come from in such a short space of time and all that we have achieved together. People are back at work. Our streets, restaurants and bars are bustling again. Pupils and students were able to return to schools and college before the summer break. Social distancing has ended. Shops are open, as are leisure facilities. Friends and families are able to once again see each other, and we can invite people into our homes. The only aspect of life which has not returned to normal is our borders. Our borders framework has enabled us to create a Manx bubble, which, in addition to lockdown, self-isolation, social distancing, track and trace, and good hand and respiratory hygiene, allowed us to achieve local elimination of COVID-19 on the island. For now, living with border restrictions is our new normal. We will transition through the 5 levels of border control, depending on the situation around us. We can already see this in action with our air bridge to Guernsey, which has been possible because of local elimination of the virus in the Isle of Man and in Guernsey. And I understand the flights to and from our respective islands have proven very popular. Indeed, 2 new return flights have been added to the schedule to meet demand. To those visiting our shores, I hope you enjoy your time on our beautiful island. Likewise, to those taking a trip to Guernsey, I hope you have a pleasant trip. That situation continues to evolve, both in terms of our immediate neighbours in the British Isles and further afield. There has been much talk this week of a second wave in mainland Europe. We have seen restrictions brought back for those travelling home to the United Kingdom from Spain, and those returning from other European countries experiencing a spike may face similar restrictions. It reminds us that as life, both here and further afield, returns to normal, vigilance must be our watchword. The pandemic is sadly far from over. But as the situation with our near neighbours continues to evolve, so will our approach, where it is safe to do so, and where the decision is right for the island. Now, at today's meeting of the Council of Ministers, it was agreed that government would work on building capability and capacity in order to potentially introduce a 7-day isolation and testing regime. Now, I must stress that any date for introducing the change will be dependent upon the infection rates in the United Kingdom and other jurisdictions. It is currently proposed that this will be further reviewed at the end of August. As you can see, work continues behind the scenes, and we will continue to follow the science as our collective knowledge of this virus grows. My job of Chief Minister and that of my colleagues in the Council of Ministers is to protect you, our island and our people. I believe the measures we have in place, border controls and strict self-isolation for those returning to our island, provides the right balance to ensure the safety of our community without jeopardising everything you and everyone on our island have worked so hard to achieve, our return to normality. So for now we have a status quo. Some pain, yes, but a great deal of gain. Our borders remain on level 4. That means you can make journeys off island and further afield, but must undertake a 2-week period of self-isolation on return. In terms of non-residents coming to our shores, only those with exemptions for specific reasons, such as essential workers or on compassionate grounds, will be able to come here, and when they do, they must adhere to strict safeguards and restrictions. The status quo and our return to normality. With this, there is increasingly less and less to tell you at these briefings. That is why they have evolved, moving from sometimes being twice daily in the early days to once a day, to every weekday, twice weekly, and now just weekly. Now, I judge this to be a positive development. The uncertainty, the concern, the clamour for new information has waned as life has transitioned back to normality. No Chief Minister would wish to find themselves in the situation that necessitated these briefings. I hope they have been fundamental in keeping you up to date and informed, and have allowed us to come together as a community. They have been a vitally important platform for which to advise, inform, reassure, and importantly, be held to account. But with the vast majority of restrictions lifted and a prolonged and sustained period of no new cases, it seems an appropriate juncture to consider how we approach keeping you up to date. Upon careful consideration, the decision has been taken that today's coronavirus briefing will be the last for the time being. We will, of course, continue to issue reminders on key advice and updates through government social media channels by working with the island's news outlets and, where appropriate, through advertisements. Should there be a change in our situation, you can be assured that our approach to communication will flex accordingly. So I say again, vigilance must be our watchword. Throughout this, you, the Manx public, have been the front line in the battle against COVID-19. Your actions and your behaviours have been crucial. You have made all the difference and are the reason we are here and where we are today. Eliminating the virus has been hard won. It has come at a great cost and it has required sacrifice. We all have a responsibility to hold the line. So please continue to wash your hands regularly and thoroughly with soap and hot water for at least 20 seconds, or use hand sanitizer. If you sneeze or cough, catch it in a tissue or in your elbow. If you have any one of the symptoms of COVID-19, please call 111 and get tested, making sure you self-isolate until you receive your result, even if you're feeling better. If you travel off island, take extra care and precautions, and when you return, make sure you self-isolate. No exceptions. These basics could make all the difference between remaining free of the virus and a return to restrictions on our lives. We must not become complacent or let fatigue set in. We are a strong and caring community that has not been cowed by this virus. What we have achieved together is truly remarkable. Let's continue to protect each other and our island. And now to questions from the media. And first I have today is Josh Stokes from ITV. Good afternoon, Josh. Faster mile.
Good afternoon, Chief Minister. We keep hearing about the potential for a new case to emerge. Obviously, we don't know if or when that may be, but can you just explain the difference in the government's approach if the new case is someone who is already isolating or someone who has contracted it within the community, and which do you think is more likely?
Well, I sincerely hope that the most likely one is that someone who's already self-isolating. We've eliminated it on the island, but by allowing people to go away freely but isolate when they come back, we do expect at some stage that one person coming back will have caught the illness and will bring it back to the island. But if self-isolation is fully adhered to, then the test will be done and we will be able to stop it from spreading any further. So that's where I expect it to happen. It would be very disappointing if it was out in the community. But, we have to trust people to respect the isolation rules and quarantine rules. And when they get a taxi home or they go home, they don't call off anywhere on their way home. They go straight to home. If they respect the rules, they will not introduce this further than their household. And when you look at the data with people coming home and self-isolating with the rest of their household, 86% of the people in that household haven't caught COVID-19 from someone who's been infected. I think 8% have caught it from elsewhere and only 6% have caught it from people who've brought it back. So if people respect the self-isolation, then it will not get any further.
Okay, thank you. And my second question is, have any discussions been had with Guernsey's government around how long this air bridge could last? And are you comfortable that there will now be business flights between Jersey and Guernsey, given there are now Manx residents travelling to and from Guernsey unrestricted?
Well, I think if you look, Josh, at the detail of what their business are, it's no different from us having key workers. You cannot just decide to go from Jersey to Guernsey on a business trip. You have to show that your business trip is really necessary. You have to quarantine when you get there. You can't go out and freely move around Guernsey. You've got to have a meeting at arm's length from whoever you're meeting, and hopefully they want it in their airport facilities. You cannot stay overnight. You then go back straight away. So we already effectively have that in place with our key worker. If a business needs a member of staff, colleague to come over from the United Kingdom or further afield, then we do allow that to happen already. So it's not a simple case of someone from Jersey just going over to Guernsey, having a meeting, freely wandering around and going back. It's very similar to what we already have. And I'm having a phone call conversation with the Chief Minister of Guernsey tomorrow. I have weekly calls just to compare what we're both doing, and if they've got a slightly different approach, they let us know. So he's explained to me how this will work, and on reflection, it's no different from what we're already doing, Josh. So, but thank you very much for raising that, because I know people will have seen that and will have been worried about it. So next we have Alex Bell from the BBC. Alex.
First to my first one, obviously at the start of the conference there, you mentioned a 7-day isolation and testing regime, which you're looking at. Can you just elaborate on that a little bit more, please? What exactly would it involve, and why wait until the end of August to bring it in?
Well, it's all about capacity. If what we're planning on doing, if the spread rate is low enough in the United Kingdom and further afield, you come back to the Isle of Man and go home and quarantine as per normal. Then on day 7, you'll go up to the grandstand where we have the testing place area set up. You will have your test. You will then go straight home again. If then the following day you get the results and it says you are negative, then you will be able to go into work. You will be able to move around the island, but you won't be able to go into a restaurant, the theatre or the cinema, where there's a build-up of people. Now, this is something that Guernsey tried and tested for a week. They've gone back to the 14-day isolation, but to build up that capacity, we have to get additional machines to do the testing. We have to get extra people to put to do the testing and put it in place. So this will take some time to build up. So we are working at building up that capacity. So if it all goes according to plan and the infection rates are improved in the United Kingdom, then we may look at implementing this in September. But there will be a charge for the test. If people don't want to pay for it, then they can go home and have the 14-day isolation, but it's aimed at helping people who maybe if they've got to isolate for 14 days, it makes it impractical for them to travel, or makes a great difficulty for businesses. So the data that's come out of the Guernsey trial so far suggests that between 85 and 94% of all cases of COVID-19 are caught in this period by doing the test. So it's something we're working on so that it will be available in September, which is about the time when students and their families are wanting to go back to university and take them with all their luggage, etc. And we hope to have it. We're not guaranteeing we will implement it in September, Alex. It's only if the data in the adjacent aisles shows that it's safe to do so. I don't know, David, if you'd like to expand on that at all.
I think you've covered it very well, Chief Minister. Basically, we need to get the microbiological equipment updated to be able to deal with capacity. We obviously need to get the staffing in place to be able to undertake that testing. But the key thing is that 7-day testing is a lot more reliable than, say, 1-day testing, because people are further on in their incubation period. So we know in the early days of COVID-19, the first 3 or 4 days of incubating it, a PCR test is in many occasions likely to return a false negative. So someone might have the virus but not actually test positive on the test. By doing a test after 7 days, you're much more likely for someone to test positive if they are carrying it. As the Chief Minister said, the range is between 84 to 94% of cases, even if they're asymptomatic, would be expected to be picked up at that point. So it is something we can now look at doing, but it does depend upon that infection rate in our near neighbours. As with everything we've decided to do, it's risk assessed.
And I presume this will be just for returning residents and not visitors who are coming over, yes?
For the moment, it is returning residents, but obviously testing will work into the later phases as well.
Yeah, we've obviously got the key stages on our borders, Alex. So we've gone from 5 to 4. Obviously, 3, 2, and 1 allow for movement for visitors, but it may then be rolled out to those people.
Well, just to move on the same point, actually, this is something which has been raised by a number of people I've spoken to in the last couple of weeks. You say the infection rate in the UK will be the biggest determinant of moving forward with border policy, moving down the scale. A few people have told me that they're not quite sure what the threshold will be. Do you have a particular measure, a particular threshold when you will move to level 3? And if so, how can people find this data for themselves, just to give themselves a little bit of an idea of when to expect a move?
Yeah, well, it's on. We did publish this and let all households know that it's the move from 4 to 3 is an infection rate of 1 in 5,000. It was 1 in 2,000 to a move from 5 to 4. And I don't know, David, if you want to add anything to that.
Yeah, so it's 1 in 5,000. The UK publishes via their COVID-19 infection survey in the UK every fortnight. It's published on the Office of National Statistics website, so that will give you the current infection rate, and it's done as a community infection rate, such as 1 in 3,900, 1 in 2,000. That's published every fortnight, so people can find it online.
Great, thank you. We'll catch up again perhaps soon, but thank you for all your conferences over the last few months.
Thanks very much indeed, Alex. We now move on to Amanda Cashmore from Jeff the Mongoose. Good afternoon, Amanda. Faster Mai.
Pastor Mai, you discussed the worry about a second wave in Europe earlier. There is also fear that we might be seeing a beginning of a second wave of infections in the UK. Are you worried about the situation there, and do you anticipate a change in the stage 4 rules for those returning to the island and living with their households?
Well, it's something we monitor all the time, Amanda, so I can't say never. If there is a significant increase in cases in the United Kingdom, we will review, and that's something our public health look at on a regular basis. If we have to review and make changes, we won't hesitate to do that, and obviously we'll call you all back to give you an update on the press conferences. Sincerely hope we don't have to do that, and that the UK are able to go from plateauing, which is I think what they're currently doing, to see an improvement. But we can never say never, and we are closely monitoring it, Amanda.
And how do you feel about the figures as they stand currently in the UK?
Well, the plateau, they haven't improved for a week or two now. They're still within the range of moving from 5 to 4, but I sincerely hope that the changes that they're making, they're doing local lockdown in certain areas where they're seeing a spike, and they are following the Isle of Man now on the 14-day locked quarantine for people coming back from Spain, where there are there's been a significant increase in the number of cases. So maybe it shows that our 14-day gold standard it has been worth following.
Okay, and secondly, the UK has focused heavily on cutting obesity following its effects on COVID-19 patients. What is the scale of the obesity problem on the island, and can we expect a scheme to be put in place on the island to improve the health of the population?
Well, I think I'll ask David to answer that one.
Yes, certainly, Chief Minister. In relation to this was the subject of a public health study. I lose track of time now. It was either last year or the year before. There are recommendations that flow off that. The Department of Health and Social Care has been working with public health on. I know that last year there was an awareness campaign done in relation to obesity and healthy living, and we will be pushing out more of that healthy living message later this year as well. So in terms of the obesity crisis, we are in a similar situation to the UK. It is very, very similar, but we have certainly been pushing the healthy living message now for about 18 months, and we will continue to do so.
And can we anticipate a mirroring of their scheme over there, or something of that scale?
No, I think we'll be doing something much more unique to the Isle of Man. I think rather the UK's scheme is geared up for something the size of their population. What we've found here on Ireland works best is education. So we catch people early, such as in the schools. I know that within the schools, pupils have been having these sessions around healthy living and what they need to eat, how they can exercise and look after themselves, and what we find works best on Ireland. So we'll be sticking with what we find works rather than copying a jurisdiction that is obviously a lot larger than us.
Thank you very much.
Thanks very much, Amanda. Manx Solutions for a Manx Situation, which I always recommend. Now we move on to Tim Glover from Manx Radio. Good afternoon, Tim. Faster Mai.
Faster Mai, Chief Minister and Health Minister. Just picking up on what Amanda was referring to, and you referred to it plateauing in the UK. Yesterday's figures there were new daily cases was 763, 2nd of July. It was at 576. It's wobbled about between those two, but it's slightly creeping up. We've got great emphasis on moving from phases downwards, but at what time and at what point with all the new infections in Europe would we maybe go back to phase 5?
Well, obviously, it's got to be closely monitored. We have to put it into context. That 200 increase, Tim, for a population of 60 plus million is a minutiae of an increase. So we've got to put that in context. I would like to reassure the public we are constantly monitoring infection rates in the United Kingdom and further afield. And if our medics and our public health give us the advice that maybe it's time to sadly go back a phase, then we will. But obviously, it'll be different to how we first reacted in March. We've got a lot more information and data now, and we will be able to make those changes with a, as I say, based on the experiences that we have, so they won't be maybe as draconian as we had to introduce in the early days when we were still finding our way. I don't know, David, if you want to expand on that.
Yeah, so if you look at the UK data, Tim, and if you go back to where you mentioned at the start of June, for instance, the following day after you mentioned, I think it was the 2nd of July, 3rd of July, 521. 5th of July, 518, then 8th of July, 632. But what matters is not the daily figures, and I think I said this about the Isle of Man when we were doing the briefings, it's the 7-day rolling average that we actually are taking. And if you look at the 7-day rolling average through the United Kingdom over the last month and a half, it's pretty much stayed the same. So as the Chief Minister said, they've plateaued. They are going to have days where there's going to be a couple of hundred more or a couple of hundred less, but that 7-day rolling average at the moment is showing it as being a straight line.
Can I, just before I move to the second question, Spain's new cases, and we've now got this isolation, yesterday we're at 2,031, so there isn't a big margin there, is there?
Well, in terms of, if we actually look
for a change of policy to come in.
Well, in terms of Spain, I mean, we've got to be very clear with Spain, is that they had actually gone right down off the scale. So them seeing several thousand extra cases per day is quite a dramatic climb from where they actually were, a very different place from where the UK is. So their 7-day rolling average is actually increasing. In terms of us actually reversing any of our decisions, if you refer to our Stay Safe document, and from memory, I think it's on page 23 of the document, you will actually find the stages laid out. In how we would unwind if we needed to. But in terms of border control, that would obviously depend if we were seeing cases being imported into the island and community transmission as a result. What we have in place with the 14-day isolation and then potentially at some future stage, as the Chief Minister said, the 7 days plus test is actually what gives us the reassurance that we should not be seeing that. But that would be the point where border control would need to be looked at again if we were seeing imported cases that were causing community transmission.
Okay, Tim, your second question.
Yeah, can I move to the antibody testing? And we had a query in from a listener. Her husband was advised by the doctor to go and have the antibody test for various reasons, but went to the blood clinic yesterday morning to be told that the antibody test's no longer being carried out. Can you just give us an update on where we are with the whole scenario with antibody testing?
Okay, David, do you want to take that one?
Yeah, so the first 5,000, as I think I mentioned, we're doing it in batches because of they have expiry dates. The first 5,000 is now complete. So we are ordering in now the next 5,000 to do the second half of the study. So the gentleman concerned will be able to have it done, but he'll have it done as the next 5,000 batch when they arrive on Ireland. But the third thing I need to emphasise is the point of the antibody testing is as a population study. So it's being done to ascertain how far COVID-19 may have spread within our community, within different groups within our community. Antibody testing is not there to tell an individual if they have had COVID-19. And even if they do show up with antibodies, we know from worldwide studies, and in fact some of the stuff we're getting from our own antibody testing, that the antibodies are actually disappearing after a few months. So it is not a guarantee to someone that they are safe from having COVID-19 again. So I do need to emphasise that the purpose of antibody testing is as an epidemiology study. It's not for an individual to know whether they've had it.
Thank you very much. Thank you very much, Tim.
For the conferences.
Thanks very much, Tim. And it's worth noting that the batch we bought only had a shelf life, I think, to the end of July. So we had to use it all up by the end of July. Then we'll buy another batch of 5,000, which we'll have to, again, handle it within a certain period of time. So I think David's explained the situation well. So now we'll move on to Sam Turton from Isle of Man newspapers. Good afternoon, Sam. Fast am I.
Good afternoon. Could you just ask you said about tests that be done after 7 days. You said to be a charge attached to them. What will that charge be?
Well, obviously this is something we're working up at this moment in time, Sam, but it'll probably be about £50 to have the test done. You don't have to have the test done. If you want to self-quarantine at home for the 14 days, then that's your choice. But if you wish to have a personal test done, then that will be available to you. But obviously, we will have to recoup the cost because this is costing the people of the Isle of Man to have the test.
Yeah, absolutely. And just secondly, in terms of antibody testing, we had the interim report come out on that. With the 5,000 being done, as it were, when will we have a further report on how figures are looking after that? And then will we have a subsequent report after the next batch is being completed?
Yeah, I'm sure we will have the report for the next batch. But David, do you want to expand on that?
So the last antibody testing report covered 3,800, just over 3,800 of the tests, Sam. To be honest, because we'd managed to get 3,800 done in quite quick time for the interim report, doing the last bit up to 5,000 wouldn't really change much from the report that's already out there. So we are now likely to report at the end and completion of the antibody testing, which will be when we've done the full 10,000, and that will be a final epidemiological report.
And when would we be likely to see that? Will that be before the end of this calendar year?
So it will be before the end of the calendar year. I would expect around about late October. I'd expect it to be late October, November time.
Thank you.
Okay, thanks very much, Sam. Now we move on to Rob Pritchard from 3FM. Good afternoon, Rob.
Good afternoon, Chief Minister. My first question, both these are looking a bit into the future, I must admit. Once the borders do start to reopen for non-residents, depending on the number of cases we're seeing maybe here or elsewhere, what possibility is there that we could see a change in policy for the likes of face masks? Could they be made mandatory in the likes of shops and restaurants, for example?
Well, obviously, all this is continuously looked at. And obviously, if you've come back to the island and then you're going back off island again before the 14 days is up, we're asking people to wear masks anyway. If you're coming on the boat, I think you have to wear them anyway because that's part of the British rules and regulations from the maritime point of view. So it's never say never. If we need to relax and we think it's an extra defence, because it doesn't stop you getting it, but it reduces the chance of you infecting someone if you inadvertently have it and you don't know you've got it and you come across someone, it will stop you potentially giving it to them. So that's the benefit. I don't know if you want to expand on that, David, at all?
Yeah, so the science around face masks and where it currently is actually aligns with the advice that we published on our website in relation to our advice to people with masks, which is that, it may protect people from someone if they're asymptomatic, if you're wearing the mask, but it doesn't protect you from other people wearing a mask. So there's a low level protection from you infecting someone else if you're wearing it, but there's certainly no benefit that's been identified scientifically in terms of you yourself as a protection. Obviously, that's something we would have to look at if community transmission started again. But the one thing I would say is it's highly unlikely to be compulsory in restaurants, because of course in restaurants you'll be sat down eating, so a mask isn't much use, to be perfectly honest. But we would have to look at all that should community transmission restart.
Thank you. My second question, again, just with regards to borders, when they eventually do reopen towards the latter stages, whenever that may be, we see something closer to free travel, as it were. If we do see a spike in cases, whenever that may be, depending on the severity, I imagine that we may have to go back a couple of stages, even possibly closing the borders again if it really is that severe. That may put us into a situation where we have to look at the likes of the repatriation process again. Now, of course, that was let's say, a divisive opinion between to the process amongst many. I just wondered what arrangements might be in place for repatriation if you did have to consider them if the case was that severe.
Well, I think first and foremost, we need to obviously look at the severity of the case, but hopefully by the end of the year there will be a vaccine out there, and that will make the decision's totally different from what we had to do in the early days. In the early days, we didn't know where the disease was on the island. We didn't know how many cases there were. We were doing the testing, and we needed to take a really strict position on that to protect the 99.7% of the population that were on island, and therefore we had the repatriation and staged approaches. Having lived through that experience, we know what works and what can reduce the risk, and the fact that hopefully, should this happen later on in the year, there will be a vaccine available to protect our most vulnerable. We will obviously be doing things different based on the experiences that we've already had. And again, Dave, I don't know if there's anything you want to add.
Yeah, I mean, just to echo what the Chief Minister said, again, if people go to the Stay Safe document the government published several months ago, again, I think it's page 23 or 26 of the document, you'll find the rolling 3-day average of cases that would actually then lead to us making various decisions. But in terms of repatriation, the simple fact is we've been learning every day as we go along. COVID-19 is a brand new virus. The details around it early on were very murky in how it was transmitted. Was it airborne? Was it not? Even actually, whether or not tests were accurate. So we've been learning all that as we go along. So the decisions made now, if we needed to roll things back, might be very different to the decisions we had to make early on with little or no information in order to protect the island.
Yeah. Thank you very much, Rob. I think it's worth pointing out that there was no guidebook that you could take off the shelf in the early days and say, page 24, subsection 5C, telling you what to do when such a circumstance came along. We were having to take the best advice and come up with our own solutions to get us in the position where we are. Now, obviously, we have that experience, and should it come back, then we are better prepared and more knowledgeable than obviously we were in the old days. And at the start of this, we didn't have the extra 50 beds that we prepared. We didn't have our own oxygen generation set up. We didn't have our 111 call centres, our testing stations, etc. So we're in a far stronger position now than we were in the earlier days, and we can look at doing things not totally differently, but less stringent going forward should we see a reoccurrence. Thank you very much, Rob. And last but not least, we have Chris Kay from Energy FM. Good afternoon, Chris. Faster Mai.
Good afternoon, gentlemen. Firstly, for you, Chief Minister, are you aware of any people on the island since we moved to phase 4 of the borders reopening policy who have found to be in breach of that 14-day self-isolation period?
I'm not aware of anything. I don't get updates from the police, etc., on what's happening there. So I would have to check. I don't know if you've heard anything, David.
Not to my knowledge, Chief Minister. I'm not aware of any prosecutions pending as yet.
Yeah, and I sincerely hope that stays the situation, that people respect it. Because if people don't respect it, we will have to sadly bring back restrictions that we sincerely do not want to have to do. So it really is in individuals' hands to respect the rules on self-isolation.
Thank you. My second question for you, please, Health Minister. Your UK counterpart, Matt Hancock, has said today he's hoping all NHS appointments will take place virtually. In terms of the lasting impact that this virus has on the way we live our lives, we'll be seeing a review of our own setup here. As although face-to-face appointments are more desirable in certain circumstances, it could both ease the burden on waiting lists and be more convenient for patients if there's now a significant rise in the number of virtual appointments.
Well, I've got to say, Chris, this is one where the UK is catching up with us because we already have it in place. So at the moment, there is telephone and video triage in place for the GP's surgeries, and the decision is taken by the GP whether or not they actually need to see the person face to face. I've said at a couple of press conferences now that we'll be looking to continue with that because it is more efficient for the patient and is freeing up GP time as well, so they can actually do more appointments, and that will continue. But ultimately, whether someone is seen face to face will be the decision of the GP, but it's already in place.
We'll continue. Obviously, we are still in this global pandemic, even if here on the Isle of Man, we seem to be coming out of the other side. Will this continue long into the future?
Yes, I will. Also, as will video conferencing, instead of people physically having to travel to appointments in the UK where it's appropriate. But that's the key phrase, where appropriate. It won't be appropriate for everyone to be dealt with over the phone or via video. There will be people who need to have a physical appointment to actually be examined and see the GP, and those will continue to go ahead as planned as well. People will be dealt with in the most appropriate way.
Thank you very much.
Okay, well, thank you, Chris, and thank you for your questions. Now, before I go, I would like to thank the media who have attended these briefings and asked questions throughout, often on behalf of the public's behalf. And finally, my thanks to you, the great Manx public. Thank you for tuning in and taking the time to watch, listen and ask questions. That's all we've got time for, so it's goodbye from me.
And it's goodbye from him.
Goodbye.